being so damn messy. Now, let's talk clinical, shall we? Mama's ejection fraction went from what to what?
25 to 19.
Help me understand what that means. Ejection fraction, everybody. What does ejection fraction mean?
Her percent.
Okay, her percent of pumping. Remember what we said about ejection. We said, and you remember that we talked about all the different times you saw that word ejection. And you seen it on, if you old like my punk ass, you seen it on an 8-track tape. You press ejection, you got hit in the head with that big ass cartridge. If you a little bit younger, but not much, you saw it on cassette tapes. You hit eject, out popped a cassette. If you a little younger than that, you seen it on the CD player. You pop eject, it slide the CD out. You seen it. Now you bougie. You don't know nothing about none of this. You got playlists and shit and all this mess. Apple Music. Okay, fine, be bougie. But I'm telling you that back in the day, eject meant something popped out. The amount of blood popping out, pumping out to the whole body went from 25% to 19%. Now you and me and everybody in this place know that normal is 75 and higher. What's the definition of congestive heart failure? When your ass is below 50, right guys? And then tell me this, because you should know it. Let's see if you do. What is the congestive heart failure blood test? What is that? 3 letters. B and P. So together, these two help diagnose heart failure. And to do this one, all you gotta know is this is an echo, and all you gotta know is this is a blood test. That's all you gotta know. So when your patient come in and they already like had a diagnosis of like heart failure, you know, like chronic, they come in and they have an exacerbation like she did throughout this last 6 episode, because she had a couple exacerbations if you'll remember. When you have this exacerbation, the first time was because she didn't take her damn meds, but when you have this exacerbation, they're going to do an echo, and remember this is non-invasive. All it is an ultrasound. It's an ultrasound of the heart with warm jelly, and they're going to draw your blood. Now, of course, to diagnose heart failure, it's going to be BNP greater than 100. But when you have an exacerbation, you already had heart failure, didn't you? You had it for a while. You be in the thousands. The BNP be in the thousands for those patients because they already had heart failure, been had it. Okay, so she was most likely in the thousands. And then the ejection fraction, like you said, went from 25 to 19. Now, I want to make sure you know this. What did they say she really would be a good candidate for?
Heart transplant.
Heart transplant. Before that, she had how many stents? She had 3 stents. What do stents do? Open up the blockage. So what are we saying? We're saying when you look at the heart, it has all these big arteries and vessels in it, and they're so blocked in this patient, right? So we put a straw. Think of a stent on your test as a straw. We stick a straw straight through the blockage, push out that gunk, and then the straw is where the blood flows. And a straw can't really be blocked up because the straw very often, or the stent, sometimes pumps like an anticoagulant constantly. Depends on what's coating the stent. But you get it, it's a stent, none the same. But she had 3 already, y'all. What did she say the doctor told her she had to have? What kind of surgery? Oh, that's so important, because if you're like me, you might have been thinking, hey, Shelly, when somebody have a heart attack, what determines if they are allowed to get stents or if they're made to get open heart surgery, which is very horrible? Remember what I said with open heart surgery? We break your ribs on purpose. We saw through your sternum on purpose. We crack your chest. We pull your heart out, put it on a bypass machine. You're going to be in a lot of pain when we're done. So what determines if you tell me I have to have open heart versus I could just get a stent or 2 or 3 max? How many vessels are blocked, and if you are a diabetic. If you're a diabetic, you're gonna get open heart. If you got more than 1 vessel blocked, maybe like 4 or 5, maybe you've heard President Clinton had, I always like to tell y'all this because I did work with President Clinton, and I remember when he came to Ohio and I was on the campaign committee, his first order of the day at 4 in the morning, because we had to go to Parma, which was the only place we could get this done, is he wanted warm Krispy Kreme donuts. So the only place that had warm Krispy Kreme donuts was in Parma. They didn't even open up till 5, and that was his first request. It's no wonder that crazy ass man had quadruple bypass surgery. What's quad mean? 4. So what does that mean? He couldn't get stents. You and Mr. Donut Factory here got to have your heart cracked, your ribs sawed, your sternum, broken. I mean, it's so important that you just think it through as to what these surgeries mean. Because if you've got to have open heart surgery, wouldn't you agree that your recovery is crazy? It's like, like 8 weeks of cardiac rehab and just crazy. Now, what about a stent? Where do we do those at? What little place do we do those at?
Cath lab.
Yeah, cath lab. Okay, let's send your little ass to the cath lab, get a couple stents. You will be gone from my hospital in a day or 2. You just got a few stents, that's all. Just put little stents in you, that's it. Recovery's so much quicker, isn't it not? Okay, so I need you to know that for this test. Because your highest priority with a person that had this, and you saw me talk about it at the boot camp, when the patient has had this, which is open heart surgery, coronary artery bypass graft, their recovery is long, hard, very strenuous. Cough and deep breathe hurts like hell because we cracked your ribs, sawed through your sternum. It's a very hard way to go. So you might have said to yourself, why didn't she want open heart surgery? Probably because of what I just told you. Is it making sense now? Why she might have refused open heart surgery? This baby told me her son was going to get stents. She called me back to tell me the baby needed open heart. I was like, ooh. So explain to the class how that hurt your heart when you heard he's got to get open heart.
It was something that neither one of us wanted, and we didn't know what to expect. And he was just dead set against it. But then when she came out and told me that the LAD is, she would have to have put 3 to 4 stents in that one, and that was too much. And she said she wasn't gonna do it. And when she said open heart surgery, that my heart just really dropped. But it ended up being a blessing and a miracle all the way around, because he had a triple bypass. When they went in, his one artery was split, so he had to have a replacement. And then the one doctor, Dr. Khan, she just kept saying she was concerned about the base of the aorta. It was inflamed, but she didn't know to what extent. She didn't know if there was any, where it was
Dilation?
like ballooning type
Ballooning,
thing.
like an aortic aneurysm.
She was afraid that it might, rupture if it was, and lo and behold,
It was.
They repaired it, and so they did everything and had one surgery. The next morning, I said I need to get down there to get his phone out of security, and I looked down at my phone. He was calling me early in the morning. I'm like, who called my phone for my, call me for my son's number? It was him. So that next morning he was up and in a chair, and in a week my son was home.
Her son is home, y'all. The one she did CPR on in the street is home. But again, You heard her reluctance to have him do this open heart. Guess who else was reluctant? Your girl, Vanita. She's like, nah, I'm good, right? She's like, that don't sound good to me. So she never got it, did she? But where is her son at now? Maybe a nurse could have made the difference. Maybe a nurse explaining, yes, it is a hard recovery, but I promise you, you won't regret it because I know this is what you need. You know, it does come with risk. It's not risk-free. I can't promise you a rose garden, but one thing I can tell you, if you pull up out of this and you come on the other side, you will be so much happier. Somebody didn't get that point across. So what did she do? Continue to deteriorate, didn't she? And then she got told that she was a candidate for a heart transplant. Here's reality. 800,000 a year are on the list for a heart transplant. Only 200,000 will get one. The others, if you heard her, I don't know if you did, the others are candidates, and yes, you kind of want to know this, because the alternative is called, and we're seeing it more and more, an Lvad. Raise your hand if you're like, oh yeah, the Lvad. Left ventricular assist device is basically a artificial chamber, not an artificial heart. Your test will get you if you say it's an artificial heart, because it ain't. Which chamber is it? The left ventricle. What is it? A battery pack on the outside that strings through with wires and whatnot to the inside. Write this down. How do you get it? Open heart surgery. So you still got to agree to the open heart surgery. Because it's. Did they give him a pig valve? There you go.
It lasts like 12.
So it's a chamber.
Yeah. It's a chamber. This right here is a chamber. Her son didn't get that.
Oh.
This is a chamber. This is the left ventricle, which is one of the 4 chambers of the heart. So don't say it's an artificial heart, because they're going to have that on the test. Don't do that. It's not really an artificial heart, because a heart has 4 chambers. It's just taking the place of the left ventricle. Because remember what I taught you, the left ventricle pumps the blood all the way throughout the entire body, and you need that. Now I have a question, real quick. I think you can handle this. I need you to tell me, what meds do you think Vanita was on? Some of them you know because you saw them earlier in episode 1 and 2. But I need you to think, what drugs would most people be on with CHF? Let's see how you do. Throw them out there, holler back. What just makes sense? Yeah, they're probably on a diuretic, right? Because don't you agree her legs are probably swollen? Mm-hmm. Yeah, she's probably on a diuretic. Now, which diuretic do you want, y'all? Yeah, furosemide, but I wish I could say that this was on your test. What's the one that I told you was actually on your test? Bumetanide, yep. I want y'all to know that, y'all. I swear, Furosa. I don't know if Furosa is an A, an I don't know what the fuck it is. Maybe an E. E maybe, huh? I don't know. Whatever. Furosemide versus bumetanide. That one's on the test. They're the same kind of thing. They're slightly different, but they're the same kind of thing. They are a what kind of diuretic? Loop diuretic. So they do what? Potassium wasting. Very nice. So all loop diuretics are potassium wasting. LPNs, that was for you. Okay, cool. What other drug you want me to throw this patient on?
Beta blocker.
Yeah, we can throw her on a beta blocker. Now, would you agree? Her heart got much worse when what happened? No, it got worse when what happened? Think it through. This episode 6, what happened? She got better after that because she wanted to give him a purpose. Remember, she recovered from it. Say it again.
When the husband started his crap.
When he started his shit and threatened to take the house. What was it about that house that she didn't want to leave? That ivy. That ivy has never grown on her house at all. It started growing right where he hung himself from the air conditioner in his room. And every morning, if you really paid attention, she would let that give her a purpose to keep going. She would look up and think, I see you, baby. Remember? Yeah, that's a irritating motherfucker, ain't it? I think she should have stabbed him in his sleep, but that's just me. I don't know. But I'm saying he took the house, right? But how can he take it if y'all not married? See? Clean up your fucking mess. Okay? Because you can't take my house if I took it in a divorce. Or we settled on it in a divorce. You can't take it. Okay? But now you know I'm finna die anyway. You see I'm deteriorating. Of course you want to take it. Because you know that when it sells, you get all the money. And I don't even get the half that I deserve from being there paying the damn mortgage. It's just crazy. Okay, so you got it, baby. Beta blocker is important because what does it do? How does it work? It blocks the stress. And she's pretty fucking stressed, isn't she? Remember what the beta blocker does. It blocks something called catecholamines. Kind of important because catecholamines are the hormones or chemicals produced when you get stressed. What is the action of catecholamines? What's the action? It's going to harm her heart every day because the action's pretty bad. What is it?
Vasoconstriction.
Exactly. Amy ain't playing with y'all answers. She tired of y'all. She getting the fuck up out of here. Vasoconstriction. You a nurse? What you doing? You passed your test or something? You come here smiling or whatever. Okay, baby. I gotta watch y'all. Y'all be tricking me some days. Okay, so now listen. Vasoconstriction is what this does. I want to make sure you understand what I'm saying. The more you and you and you, and then over here, you and you and you, and then over here, you and you and you, and then back here, you and you and you. The more any of you, the more stressed you are, the less blood flow you get. Because catecholamines cause vasoconstriction, which means you're going to literally stop perfusion to your organs. What organs, Shelly, in her case, and anybody else that already had a fucking heart attack? She had two. Her heart. So now, no wonder you went from, what number was it? 25 to 19. Because you're very stressed. Why did she live longer than most with 25? Because I don't know if you remember episode 1, 2, 3, and 4. But she was walking. She was walking to the bus stop. She had to walk to the train. Her legs hurt. Don't get it twisted. We talked about her intermittent claudication and peripheral vascular disease. We talked about that all the way back in episode 3. But she was walking. And what does walking do? Vasodilate. Your heart got more oxygen and blood flow than it ever has in your life when you walked to go see your son. And what did she do? How many buses did she have to catch? You remember? 5, 6 damn buses, a train. Had to do that every damn what? Because she's a real mama. Every weekend to see her son. And the motherfucker got the money, did not go see him once, thought he was guilty the whole time.
They had the $900 for the bills.
Right. Could have paid it. He worked for RTA. Your version of RTA, that's where he worked. In New York. He worked for that. So he made good money. Yeah, right. So you feeling me yet? Y'all all right? Y'all good? Y'all can see. You say you're not all right. You want to kick his ass. Let's go find that bastard and jump him, y'all. Let's go and find him.
Keep going hard. Keep going stronger than boo. You get nothing.
You get nothing. But I need you to know that's the messiness in divorce and marriage and all this. Stop, close it off. If you're done with them, get done. Don't linger, because I see this in families all the time. Nurses are really weird. They're caught in the middle of this because they're in the room witnessing this crazy shit that you just can't believe it's really happening. And you be like, wait a minute, whoa. You his child? I'm the real child. She's stepchild. She don't get shit. I need all his information. This is what you're in the middle of. You thought that was the child. Because this bitch ain't been around at all the whole time he been in the hospital. But she pop up with it, Dad. Because she knows some money involved. It's just unbelievable. Okay? And you cannot do anything about it. Not a thing. But get this woman this information. You have to give her everything. She by law gets it. Ain't never did nothing for her dad or mom or whoever it is. But by law, she is the blood kin. It's kind of messy. Okay?
So for those catecholamines, okay, we have good stress and bad stress.
We do. So let's talk about that, because short term is good. Now, you all are stressed. You wouldn't have never signed up for my crazy punk ass if you wouldn't. Because you're stressed enough to go, fuck my life. I got to pass this test. I heard this bimbo across the street was good. Let me go and sign up for her class. Okay, so that's good stress because it made you motivated to act and do something new and different, didn't it? Okay, but bad stress. What is bad stress? Repetitive. Something you can't get out of. Something you can do nothing about. Bad sleeping with the fucking enemy. Yes, baby. Wait a minute, let me go mop all y'all streets and down your parking lot. Your child in the basement, never moving the fuck out. Grown as fuck. That's for all y'all mamas that that had the problem I did. I had to kick her out. I never thought I'd kick out my own child. You got to get the fuck out of here, because this whole 6 months turned into 3 years and you still ain't doing shit. Okay, so you kind of got stress like that's really difficult for you to manage. And then you have the other stress. I got to take an NCLEX exam. Oh my God, I got to run a marathon. I said I would do this for my father who died of colon cancer. I'm going to do the colon walk, but I signed up for the marathon. Okay, that's stressful. Yeah, okay, whatever. But I mean, we just got a new puppy. The bitch cries all night. Okay, it's stressful. Whatever. I mean, there's good stress. There's bad stress. The bad and the worst stress is a type of stress you cannot do anything about. And the bad and the worst stress is the stress that affects a patient with a compromised heart. That's where I'm going with this. You're like, well, damn, really? Okay, so if you have a compromised heart, you're going to do yourself in. But there's one more condition that gets done in when you are stressed. It's this one. OMG. Stress doesn't just cause vasoconstriction, everyone. It also causes something Vanita did not need, if you'll recall. Stress activates cortisol. Yes, it does. Cortisol is a steroid. A steroid raises blood sugar. Vanita was already a diabetic. Who dies of heart failure? Diabetics first. She was a diabetic. I would imagine any given day that we checked her sugar was well over 200s, probably even in the 300s. Probably her hemoglobin A1C was hanging around 9 to 11. Cancer thrives off blood sugar. If you want to kill cancer, or at the very least shrink a tumor, give them a keto diet. We're finding that out now. Keto diets make cancer tumors shrink. How cool is that? That's why you don't see me eating a bunch of sugar, because I don't want none of this shit. It makes cancer grow. Catecholamines vasoconstrict. It's awful. Okay, so this is why, if you can, and you will, when you kind of get out of this class and start your life, recognize your own stressors, and if you can do something about them, great. But if you can't, then of course you're going to need an outlet. If it's a Zumba class, if it's Pilates, if it's yoga. For some of y'all, it's line dancing. It could be just anything to get you up, out, and moving, because you forget that exercise has something called endorphins. They beat these up. They kick their ass and throw them out. Endorphins vasodilate. Endorphins give you a wonderful mood. Even if it's temporary, it stops the madness. Any questions about any of this? Because you're done. What?
What do you give her lisinopril? Like,
Yes. What is that for, though? What's that ACE inhibitor for? It does two things, and if you don't know your ACE inhibitors, everyone, because it's hard to know them, they're hard. Lisinopril drugs, ACE inhibitor, vasodilates and diuretic in one pill. That's kind of cool, because it stops angiotensin. Okay, very nice. What about digoxin? Could she use that? Yeah, she was on digoxin. What did it do for her? Come on, what does digoxin do? Digoxin don't give you no damn energy. What does it do? There you go, that word. It strengthens the pumping of the heart. If you're in heart failure, don't you need to strengthen the pumping of your heart? That's what digoxin does. Yep. Okay, y'all, if you